It's 6:07. You're listening to the evening edition with Lynn and Sharmila, and it's official. Private hospitals will now be managing COVID-19 cases at least up to the ICU care level, and this is to assist with managing the pandemic here in Malaysia. Of course, previously, you may remember that all COVID positive cases were referred to government hospitals and healthcare, whether it was at a hospital level or low-risk quarantine centres, which we've been talking a lot about.
So the thing is that private hospitals are now expected to, as you said, manage their own COVID-19 cases, right? What this means also is that MOH won't be accepting case referrals from these private hospitals. And in fact, they might actually start transferring patients to them because for reasons that we've been talking about off and on for quite a while, the fact that the system is strapped, current bed occupancy rate in COVID-19 hospitals are actually at over 70%.
Yeah, so I think to give you some perspective on this, right? So that 70% is important. ICU beds, meanwhile, for COVID patients are fully occupied in Kuala Lumpur Hospital and UMMC. 83% in Sungai Buloh Hospital. And I think we have to remember also that these are hospitals that have really been bearing the brunt of COVID-19 for as long as it's been in the country. These are the hospitals that we've been hearing about this entire time here in the Klang Valley, here in our state. And I think now with the cases being what they are, it's more important than ever to look at those numbers in these hospitals. Meanwhile, outside of Selangor and Kuala Lumpur, ICU bed occupancy rates for coronavirus patients in other states such as Perak, Melaka, Terengganu and Sarawak have also exceeded 70%.
So how this is going to work is thus far, 1,138 beds have been identified in 97 private hospitals. This was done by the Association of Private Hospitals Malaysia, or APHM. These beds will also include 70 critical care beds. And if you were listening to the Prime Minister yesterday announce the PERMAI allocations, 100 million ringgit was allocated for this private and public hospital partnership.
So a lot of questions here, I think, including whether or not there is... So it's not so much about capacity, because 1,138 beds, that's the capacity. But I think it's another sort of capacity. It's about whether or not there is sufficient experience among the doctors in the private sector. There's also about it's also about the allocation of resources. So the beds are one thing, but what about the kinds of resources that we know are required to care for COVID-19 patients? And I think it's why earlier on when we spoke with Dr. Christopher Lee, Datuk Dr. Christopher Lee, who is an infectious diseases physician, I wanted to know how do we understand the turning point, right? The possibility, the worry here is always that turning point. And while you might be in a hospital, if you're not necessarily in a hospital that as yet right now has the capacity to address this, should there be a dire need? I just worry about that.
And I mean, what that capacity actually means on the ground can translate into many things, right? From having the training to deal with COVID-19 patients, to having sufficient resources to create specialized areas that deal with these patients, from the transporting of patients. It's so many layers, which while the COVID hospitals, the public COVID hospitals have been dealing with for nearly a year now, this is going to be a fairly sharp pivot for the private hospitals that have been identified.
So we're going to be speaking after this with Nadiah Wan, who is the CEO of Thomson Hospital, Kota Damansara. But before that, we wanted to look at some of the messages that have been coming in. So, for example, we have Dr. RKJ on WhatsApp saying it's time to make use of military hospitals as COVID-19 quarantine centres. We have Lumut Hospital in Perak, Tunku Mizan in KL, and Terendak Hospital in Melaka.
So this is an idea that I remember came up very early on in the pandemic when we started talking about resources. And I do believe it's something that's not really been addressed since then.
We also have someone who wants to be known as Sad Malaysian saying the MOH should ask help from China to set up temporary relief centres before things get worse. Home quarantine, and this is in reference to our previous story, is scary and not safe to people in the same house and those alone. And I think this really speaks to the worries that a lot of us are feeling, especially in terms of how stressed our healthcare system is. Lastly, just to briefly summarize, we have an opinion coming in from Dr. Kaw Swee King, health policy specialist, also somebody that we frequently have on the show, saying that yes, specific plans are being made now. For example, what patient categories are treated where, how private hospitals will dramatically adapt their physical and human capital infrastructure. Also, who will pay for all this? And these plans are being made during a period of high pressure for our health system, and they can and should have been made much earlier. But some initial details are welcomed. So, for example, the Prime Minister's announcement of 100 million ringgit. But then again, we come back to the point about details, decision-making criteria for how to allocate, the mechanism for paying that, whether there will be bulk negotiation with private hospitals. The presence of Bank Negara also indicate that private insurance may also be called upon to perform a national service. Dr. Kaw also brings up the fact that the spectre of nationalisation hangs over private hospitals in Malaysia this week. And there are plenty of opportunities for orderly partnership with a collaborative spirit without resorting to blunt instruments of coercion. So I think that paints an interesting picture, especially against the backdrop of the proclamation of emergency and the emergency ordinance.
Yeah, I mean, I think at the end of the day, this comes down to not a refusal by the private sector to lend their expertise, but I think a need to consider the nuances of the situation and to give enough details that they are aware of what is expected of them and whether they can deliver. Because it's one thing to have these things on paper. It's another thing to actually see it come into practice. That question of who's paying the bills is always something that's important when it comes to profit-making ventures like private hospitals.
So if you've been wondering how all this is going to work, send us any questions you might have. That number to call is 77332900, WhatsApp 018-789-8899, and tweet us at BFM Radio.
Boleh for Malaysia. Ha. BFM 89.9, the business station.
It is 6:14 and this is the evening edition with Lynn and Sharmila. We're talking about how private hospitals have now been included in this fight against COVID-19 in a more direct way because they'll be managing COVID-19 cases up to the ICU care level. And this has opened up a lot of questions, I think, about capacity, about preparedness, about who's going to foot the bill. So we are going to be speaking about all these things. Send us your questions. That number to call, 77332900, WhatsApp 018-789-8899, tweet us at BFM Radio. Now on the line with us is Nadiah Wan, CEO of Thomson Hospital. Nadiah, it's good to have you with us. Thank you so much for speaking.
Hi, good evening.
First of all, can you walk us through the agreement between the government and private hospitals in terms of lifting the COVID-19 burden from the public sector?
Okay, basically there's no written agreement, but what we were informed last week by the DG was that private hospitals would now have to manage their own COVID patients and that public hospitals would not be receiving any more transfers or referrals from private hospitals when they find that one of their patients is COVID positive. The third alternative has been if the public hospitals in their area are unable to cope, they may transfer COVID positive patients from the public hospitals to the private hospitals.
So what were some of the initial questions or concerns that those from the private sector had about this arrangement?
I think aside from the usual sort of like the concerns around ramping up the facility and the manpower, there was also concerns around the liability. Because as you know, private hospitals, the doctors are treating the patients. And I suppose unlike in the public sector, there are a lot more medical legal suits that are being filed against private hospitals and doctors. So that was a key major concern as well.
Can we get down to, I guess, the nuts and bolts of it, right? Because how different are private hospitals' setups and resources compared to what we see in the government sector when it comes to tackling the pandemic and the specific needs of COVID-19 patients?
I think there's really no difference. I think the only difference is that public hospitals have had 1 year experience in dealing with the COVID pandemic, and now hospitals in the private will have to really have a very steep learning curve in terms of getting the resources and facilities ready to deal with COVID, which is an infectious disease. So I think some of the issues that we are, rapidly trying to look into are the rectification of the facilities, the scaling up of the manpower, implementing of different SOPs and getting up to date with the latest knowledge in clinical management, because COVID is still a novel disease, and the knowledge about how we treat COVID is changing from time to time. So suddenly, I think everyone has to really pull their bootstraps up and really get this going, whereas the public sector probably faced this issue 12 months ago.
So could you give us some insight into what sort of training is required for this kind of expertise? How long would this take?
I think in terms of training the staff, in terms of infection control measures, that has already been ongoing because COVID has been in the community. But I think now is more specifically in terms of the clinical management of COVID patients, because we have not been treating them in the wards. And these sessions are ongoing. People are sharing material, and I'm sure the doctors are also reading up on research journals to find out what are the latest recommendations. We are working with the MOH to actually get in the drugs that are being used, because at the present moment, only the public hospitals have those drugs.
Perhaps you could also talk to us about some of the protocols and SOPs that will be crucial in protecting your staff and also patients who are in the hospital to receive non-COVID-19 related care.
I think the most important thing, there are a few key principles about COVID that's well known. The first thing is, of course, for any infectious disease, we would like to isolate them. So obviously, we would like to have a separate ward, separate beds where we restrict entry, restrict different people from being exposed there, so that isolation is really important. Number two, because it's a respiratory disease, ventilation is also really important. So we now know that the primary mode of infection for COVID is through respiratory aerosols that hang out in the air. And so things like having negative pressure or increasing the exchange of air cycles is important to ensure that the risk of infection is low. So that's also something that needs to be done. The third thing, I think, is risk reduction. So if you don't emit the aerosols, then they don't get into the air. And therefore, that's why masking is really important, universal masking. So all of these SOPs have been practiced. It's just, I think, the more important part now when we admit the patient is looking at the admission and discharge flow, where these patients will be located, how will they be transported, and at the same time really ensuring active monitoring and vigilance for the staff as well, in terms of daily audits on compliance, making sure they know how to don and doff the PPE, because putting on and taking off your PPE are one of those points where you are exposed, and that's also a high risk moment. And expanding testing for the staff. So it's really important that I think all staff in the private hospital have rapid access to testing. I believe they do, but I think that we would want to monitor the staff health as well to ensure that the staff safety is safeguarded.
So has Thomson Hospital already been dealing with COVID-19 cases before this? What has that been like?
I think, COVID has been in the community, particularly, I think, for the past 2 months, where we've seen the number of cases really increase dramatically. And we have had patients admitted into our hospital who have become COVID positive, or we have COVID positive patients that land in our hospital, and it's taking longer and longer to transfer them to the public hospital because, of course, there were not enough beds. And fortunately for us, I think we had already during March of last year already discussed many of the SOPs and protocols that needed to be put in place. There was a lull period, but basically what we needed to do was just reactivate all the plans that we had in place to make sure that the staff, the doctors, and the patient themselves are also protected when we are dealing with these COVID patients. So we've had one or two, but I think now it's just preparing more beds to see more of those patients.
Right. So in terms of preparation then, is Thomson equipped at the moment with adequate manpower, beds and ventilators to accept COVID-19 patients?
Well, I think that what's good is that the government has asked us what we are prepared to take. So I think that that's really important. They're not just assuming that everyone is able to take any sort of case. So we're lucky at Thomson. We have an ICU, we have intensivists. We do have a bed that we had been previously using to isolate patients who have not had their COVID test results out yet. So we are ready, but the capacity is really up to the individual hospitals, and that has been communicated to the Ministry of Health.
So the government has allocated 100 million ringgit to facilitate this partnership. How would you like to see these funds be used?
I think this is a very important step for us to accelerate public-private partnership. And really, the budget should be used for the public sector to purchase services from the private sector and, in essential, outsourcing those services that they have not had the capacity to deal with, whether it's COVID or, more importantly, the non-COVID cases. So let's not forget about the emergency, semi-emergency cases, cancer cases. These people need to be seen. There is some relative urgency, and there are private hospitals who can readily provide that service. And similar to schemes like Medicare and Medicaid in the U.S., where the government purchases this service through an insurance scheme, but here we just have that budget. They can purchase the service, negotiate that rate from private hospitals, and we'd be happy to do that.
So on that point about cost, right? Because I think that that is a huge concern at the moment. Have those conversations taken place? I mean, what would it cost a patient who has COVID-19 to be in the care of a private hospital?
Without any subsidies, I think the cost would be quite expensive. And the reason is because, unfortunately, those people with COVID who need to be hospitalized require a relatively high level of intensive care, which means that they either need some sort of oxygen support, round-the-clock monitoring because they have breathing issues, or even in Category 5 where you have a multi-organ or systemic failure. So we have sort of done a rough estimate, and in terms of the admission duration as well, it's quite long. It could go up to like 2 weeks on average. And so if you were just admitted to a general ward for 2 weeks, it would probably cost 10 to 15,000. But if you're going to be admitted in the ICU for that long, it would probably cost 3 times as much.
So who would then be bearing the costs of this care? Does it fall squarely on the patient? Where does insurance factor into all of this?
I think the problem is that COVID is a novel disease and it's also a pandemic, and nobody has factored that into their calculations of the insurance premium. I guess the government has not yet activated this public-private partnership in terms of purchasing services. So at the present moment, it seems like the patient will be bearing the cost.
So as we kick this off then, does this open the door for more public-private partnerships in the future, and what form might that take?
I definitely hope that after this pandemic has settled down, that we have serious initiatives to really look and review how the public and private sector healthcare in Malaysia work together. Because I think right now that the resources in either side of it is not being maximized in a good way, and this purchasing of services from the private sector had been discussed previously, and I think COVID is just going to accelerate that. The other thing that I think would also happen is that the increased sharing of data, which has become very important in terms of managing this pandemic. So I think it would be foolish of us to lose that momentum that this pandemic has given us to really look and review on our dual healthcare structure and how we can make it more sustainable for the future.
Now, for patients who might be concerned about going to a private hospital for medical help during this time, what are your suggestions or advice?
So the private hospitals are, of course, taking all the precautionary measures to ensure that the safety of the staff and patients who are coming, those COVID and non-COVID. But I think the basic precautions for any person applies, and it's not just about the private hospital. Really, the environment in the hospital is such that people are usually alert and aware. And we see that actually most of the time, even for the staff, when they get infected, it's out in the community because that vigilance is lacking. So basic precautions are still very important. Masking, distancing, washing your hands and sanitizing, all of those, even if you had a COVID patient next to you, but you were literally 1 to 2 meters away, you'd be okay. In fact, the doctors in Sungai Buloh were sharing in a session that they had with the private hospitals. Some of them are reviewing patients without having the full suit and get up, but they just maintain their distance and they just go around to each room and seeing these patients. So we know how COVID's transmitted. We know what behaviors can protect ourselves. We just need to be vigilant in ensuring that we, comply and maintain those behaviors, both for patients, customers, and also for our own staff.
Nadiah, thank you so much for weighing in today.
Thank you.
That was Nadiah Wan, CEO of Thomson Hospital, speaking about private hospitals now being included in the care of COVID-19 patients, essentially not referring them on to government hospitals as has been the practice so far. If you have questions on this, if you have thoughts, send them our way. That number to call, 77332900, WhatsApp 018-789-8899, and tweet us at BFM Radio.
Thank you for listening to this podcast. To find more great interviews, go to bfm.my, BFM 89.9, the business station.